Hello everyone. Welcome to Hyperscale LFDT Healthcare Special Interest Group monthly meetings. I am Dr. Anasuya, the chair of Healthcare Special Interest Group. So, this is the second meeting in this year. So, let me share the uh, agenda for today's meeting. I believe my screen is visible.
Yes, the screen is visible.
The meeting agenda notes, right?
Yeah.
I could see few new people have joined this meeting. So if you wish, you can introduce yourself. And it is a open source community. All are welcome, and there are no strings attached anywhere. So be sure whatever you tell, it is recorded and it will be available on the YouTube channel. So please introduce yourself if you wish to. Yes.
This is Amita here. So I have been into software development from the beginning of my career. So I have like total almost 20 plus years of experience. Uh, so blockchain is something which is like kind of new to me. Though I've read about it, I've not actually used it. And currently, I have my own startup called as Winby Technologies. I'm more into algo trading. So I am very interested in knowing like how I can use probably blockchain also for algo trading.
Okay, thanks, Samita. That's really good to know about you. And is this your startup spelling correct or?
No, it is
Oh,
WYNBY.
okay. Okay, I have heard about this startup. So somewhere like I have come across. I will once again go and check it. And
Hmm.
once again, welcome. Uh, Raju Mahindra, you want to introduce? Raju,
Yeah,
you have attended earlier meetings also, right?
no, this is the one. So last time,
Okay.
this is the first time. So hi guys, this is Raju. I'm presently working as software blockchain developer in NPCI. So it was my first meeting in healthcare. I mean healthcare in LFDT. So it was good to know and meeting big people. Hoping that I can gain more insights from you guys. Thank you.
Yeah, welcome, Raju. And actually, Raju, we just finished the mentorship project. He was my mentee. He has done a wonderful job in designing the BiniBFT algorithm, consensus algorithm. So, that's from BiniWorld uh, as an open source into LFTT. Yeah, welcome again, Raju.
Thank you, Anasuya.
Hey, hello to everyone. Am I audible?
Yeah, you are audible.
Yeah, this is Dr. Mahendra Srivas this side from Center of Excellence Cybersecurity at the School of Computer Science at UPS Dehradun. And I'm also founder of India Quantum Labs. I do hold a PhD in blockchain technologies, and I'm the founder of India Quantum Labs. And what a great day to join the special interest group. Today, as I speak, our book called Blockchain, Quantum Blockchain is published by BPB Publication. So this book is basically for the graduates and postgraduate and PhD scholar students, and also it is for industry professionals who wanted to start with blockchain technologies, and also it is for professional who are in cybersecurity, AI, or web technologies. They can upskill themselves through this book. So the book is online at amazon.in. So if you are interested, you can go through with it. And first of all, thank you for sharing this meeting link to get connected with this special interest group. And at India Quantum Lab, right now we are working on defense use cases. And also we are having some ideation around the healthcare system, right? So it is a great platform to collaborate and contribute. So thank you very much.
Welcome, Mahendra, and all the very best. Like it is a great achievement, great thing that you have done. And on quantum blockchain, coming up with the books, that is like fantastic one because it's a booming sector, right, in blockchain. So like, thank you for that. Could you like share the link for the book over here so I can attach it in the meeting notes itself? And what is the title of the book?
So the title of book is in quantum blockchain, and basically it covers the start with basic foundation of blockchain technologies, like basic blockchain concepts, and also it covers the use cases. And we have exclusively covered 5 blockchain platform, including IBM blockchain platform, Hyperledger Fabric, and other blockchain platform is also there. And it does not cover the use cases. There is a whole lot of practical sessions. So this book is a single point of reference where you can learn the concept, you can apply, you can know about the use cases, and also you can do coding for smart contract as well as Web3 DApp, right? So we try to make it comprehensive for tech people or the beginners who wanted to get hands-on exposure to blockchain technologies.
Okay.
And at the end, this is it also introduced the concept of quantum computing and quantum algorithms. And then the last unit is dedicated to quantum blockchain.
That's great. That's great. So I will be eager to read the book. I'll get it and read it. Thank you. And please share the link for the book in the meeting chat so I can add it over here itself. And our
Sure,
next
sure.
thing is most waited, like fireside chat with Mr. Amit Chandra. We know Mr. Amit Chandra, he is one of the person who is working on the blockchain field for a very long time, and like he is acting as a advisor for government projects, like he is related with most of the Indian government projects on blockchain. So I welcome you here, Amit. So please introduce yourself from
Thank
your
you,
side.
Anasuya, for
Yeah.
welcoming me to this exciting event of Hyperledger Fabric. And one thing about Hyperledger Fabric is that I'm always involved with this open-based community, and whatever the learning I'm going through, I always share with this community because I feel that this is the most engaging community where the exchange of knowledge always happens between the participant or the community member who are part of this. First of all, my name is Amit Chandra. I have got 17 plus years of experience into the IT industry. I started my career as a developer, technical, in mainframe technology from Patni Computer System, and then I move on to the IBM India Private Limited, where I worked for 10 plus years in mainframe technology. And after that, a certain uh, scenario came in my life where I came to know about this blockchain technology in the year 2017-18, and that fascinated me about this technology. And I thought that why not to move ahead with this technology. And after doing lot of research and being engaged with IBM, I learned a lot about this technology, and from that time, I've been a part of Hyperledger around 2017-18, and then I joined a couple of multi organization where I have did lot of work into this field of blockchain technology, but that is too into the private sector, that is related to the supply chain, that is related to the marketplace DAO platform, where the public and private blockchain have been involved. Then I got a chance to work with the public sector, that is the government sector, where I have been working for the last 2 years, and I have been, my daily life is to interact with the various department of the government sector, understand the problem, and try to figure out the whether this blockchain technology will provide a static solution to them or not, or whether it is feasible or not. That is very important when we discuss about any technology, because if we say that blockchain will be helpful in every technology, then that is a myth. Okay, there is always a limitations of a technology, and one should understand about that. And with this experience, I came to know that what are the limitations is all about, and how effectively it could be implemented. So for the last 2+ years, I've been working for the government sector. I've been working for several government and providing them the solution about the blockchain technology, in order to build the capability of the department into this in the adoption level of blockchain technology. I provide a lot of training sessions, and the numbers are uncountable to whom I have given the training sessions. I've been a part of various kind of open communities where I work as a blockchain advisor in the open platform, where wherever required I provide my input to that community for the betterment or to increase the innovation sectors of this technology. So this shows the overall small biodata of myself, of 17 years spending in this technology. But one thing I missed is that I started with the technology mainframe, which also works on the data. So soon we are going to start with the fire chat with Anasuya. I'm going to tell you about the legacy technology and the emerging technology both, and it will be helpful for you to understand in a detailed manner. So that's my introduction, and hope we will be connected in LinkedIn. You can go into my LinkedIn profile. My name is Amit Chandra. You can check it me into LinkedIn, and you can share a connection with me, and I will be happy to connect with you. Yeah, Anusha, you can go ahead and start the discussion.
Yeah. Thank you for the nice introduction, Amit. So, like today's topic that is chat with you, like especially like showing, like asking about like how blockchain is being used in the healthcare industry.
Yeah,
So, like if you take the healthcare industry, we have like the data, the patient data is very sensitive. See,
yes,
the security has to be the like highest preference along with the privacy. So, like
correct.
how blockchain is being used over there. Could you just give a brief about
Yeah.
that?
So that is very correct that the data nowadays is very important, whether it is for the patient or whether it is for the individual. And data is being compromised when anyone will able to misuse that one. That is the most primary one. So when we talk about blockchain, it says that the primary objective of this technology is to keep the data secured. Okay. It encrypts the data. Within that encryption, it provides the signature of the owner of the data, and that gets stored into the blockchain. It is nearly impossible in blockchain that anyone will go and edit the data. Okay. Where in the case of centralized, the chances are very high that anyone can go and change the data and there will be no record. But in the case of blockchain, if anyone wants to change the data, if they intend to change the data, then a new record is going to be added. How it is going to happen, how it is going to help if anyone change the data, is that down the line, if someone wants to see that who all have changed the data, it will be within a single click. One could able to know that the data has been changed from X to Y. So that is very important in the case of healthcare, because the data of healthcare are getting misused a lot, okay, for the profit, for the benefit of the medical or anything. So if we keep the data in the ownership of a patient, then it secures the data, and if anyone wants to have some any kind of information of the patient data, it will based on the consent. Without the consent of the patient, no one will be able to access the data or retrieve the data. And that thing will be provided whenever the data will be stored into a multiple location. If the data is stored in a single location, then it can be easily manipulated. But if the data is stored in a multiple location, then it is quite difficult for anyone at the same time to update the data at all the location at the same time. And if any one of this location is not been updated, then a notification will be generated that it has been tampered. So that is how a blockchain will provide a security to the patient data. So that's the first answer to your question, Anushya.
Yeah, that's actually like uh, wonderful the way the blockchain works.
Yeah,
So
yeah.
its beauty is like immutability. So like
Yes,
no
yes.
one can like tamper it.
Yeah,
And
yeah.
so when we
Yeah,
are giving
basically,
this,
when we talk about immutability, it says everything about the data that no one will able to change it. Right.
yeah, yes, yes. And like, what are the big challenges in implementing blockchain in healthcare?
So see, uh, blockchain is always a prominent use case. And when we talk about healthcare, healthcare is a prominent use case for blockchain. But as you talk about few of the challenges, is that rearranging the prepare means, it means that creating the ecosystem. It means that if suppose a patient has a data and the patient wants to share the data with some other hospital, then it is quite challenging to build that ecosystem where all those hospitals will come together. They will follow the same standard rules and process to update the data. That is one more challenge. The other challenge is that we need to check that how many transactions for a particular patient or a user is being done on a daily basis. So we need to make sure that whatever the data which is getting updated, the frequency should be less. Because what happened that whenever a data gets added or updated means a new transaction is getting added into the blockchain, then there is a kind of endorsement policy. It flows through an entire journey before those data get recorded into the blockchain, and it takes time. It takes time about a millisecond. So if the number of transaction is high, then it might be possible that it will take some time to commit those data into the blockchain. So first part is that we need to make sure that how many number of organizations, whether they are willing to collaborate with each other or not, that is one of the problem. The other problem is that we need to make sure that whenever a data is getting recorded into the blockchain, how many parameters we want to store. The number of parameter get increased, the transaction commit will get increased. So we need to be very careful in the terms of storing the data into the blockchain, and we only have to store those data into the blockchain which are very important in terms of audit, validity, accountability, and transparency. So these are the factors we need to take care. And every in the case of healthcare, all the stakeholder, all the hospitals, for example, if I take an example of a particular hospital, then the entity of all those hospital or the joint hospital has to come into an ecosystem where they will build an ecosystem, and they will create an understanding that, yeah, we will accept this kind of terms and conditions whenever the patient transferred the data from one hospital to the other hospital. So that is one challenge which need to be built. Okay, and once that is being built, when everyone convenes with that particular ecosystem, it will be quite easy and beneficial for the hospital also and the patient also to adopt the technology and get the benefit out of it.
Yeah, that's really useful. Like we have to consider what are all the like important parameters to be used, and instead of going for everything, focus only on that.
Yeah, yeah,
Like the transactions can be reduced and the speed can be increased, right?
correct.
So like uh, is any like real world applications on healthcare has been already implemented? If so, can you like give some light
See,
on that?
there are a lot of healthcare which has been implemented, but that is into, some of them are into the pilot stage. Okay, why I'm saying into the pilot stage is that there are a lot of rules and regulations which need to be take care. One of the rules and regulation is the HIPAA, GDPR, the patient privacy. So what happened, that what I have seen, that one of the use case is related to the drugs traceability. Okay, so drug traceability, it means that whenever any patient buys the drugs, why not to give him that kind of privilege to know that whatever the drugs which it is he is purchasing, he or she is purchasing, is not expired, authenticity of the patient. Okay, because we know that what is the cost of a particular medicine nowadays, there it's cost huge. And it's not about the money which the patient spent, it's about the genuinity of the medicine, that whether it's a genuine medicine or not. So if it keep track of the entire journey of a drug from manufacturer to the medical store, and whenever the patient purchase that one, that it gives a kind of confidence to the patient that whatever he is purchasing, that is an authentic product. That is one use case where there is a kind of drug traceability. The other kind of use case is the OPD claim settlement. In the public sector, there are lots of subsidy given to the citizens on the OPD claim settlement. So why not to build a kind of solution where the government will able to understand that whether the subsidy which has been allocated to the patient are being utilized properly or not, or whether there is a double spending or not. So that could also be solved with the help of blockchain. The next part is the patient health record. So this patient health record is very important in terms of research part for the medical industry to research any kind of rare kind of diseases, and based on that the medicine needs to be researched, and how that could, and based on that only the patient data are being compromised in a different way. I will not go into the detail, but that is the fact that the patient data is getting compromised. So why not to give the ownership of the patient data in the hand, with to the hand of the patient only? Whoever the patient wants to share the data, he or she will be able to share. If he or she wants to revoke, he will be able to revoke. In the near future, if he says that there is a kind of any kind of misuse of the data, he can complain on that. And wherever he complain, he will get the audit report of those data in an immutable manner, which provides that no one has edited the data. That is a fact which the patient is presenting to the auditor, and based on that, whatever the action the auditor is going to take, it will be based on the fact and figures only, because law is based on the fact and figures, and if the fact and figures get manipulated, then we are playing with the laws. Okay, but if somehow we are able to preserve the fact, then the giving the decision based on the fact will be more easier. So in that process, the patient data will get reduced, and these are the few use cases of patient health record, OPD claim settlement, and the health record of the patient when it's sharing to multi organization. Drug traceability are few of the example, real time examples.
That's great. Actually, there is some work was going on in the insurance sector also, isn't
The
it?
insurance sector also, there is one more going on because insurance settlement
That
also
is the
requires the
biggest,
even. Yeah,
biggest
yeah, yeah,
thing.
yeah.
So worldwide, that is the biggest issue. So I think blockchain will be the best solution for that.
Yeah, it's
Like,
provide a real time. It provides a real time update or real time data to all the stake with which with a kind of transparency, and whatever the record they are seeing, it is immutable. It means that it is not editable when it is coming to. So it build a trust between the stakeholder that whatever they are looking into, it's a it's a fact. No one has edit. So it's basically it's help all the stakeholder into the insurance agency to the government sector to the drug supply chain. Everywhere it could be used by building an ecosystem.
yeah, that's correct. So how we can like the blockchain can help in improving the interoperability between different healthcare systems.
So see, in this, as a practical experience and my day-to-day life, when I go into the different department and when I meet different stakeholders, it's all about collaboration.
Yeah.
Yes. So I will give an example. Suppose there is an hospital in a state X, which is a big hospital for that state, and that referred to the AIMS hospital in Delhi.
Okay.
Okay. So whenever, if there is a chance that whenever that hospital of X, which is a big one, is not able to solve the problem of the patient, then it referred to the bigger hospital. So why not to create a ecosystem in such a way that whatever the data or whatever the checkup which has been done by the hospital X, when it referred to the bigger hospital, they will trust those data. They will trust those prescription. They will trust those checkup which has been done for the patient. In that way, what happened? The patient does not has to go through the same problem again and again. It is not about the money, it's about the problem also, or it about the frustration which the patient has to go through. So is there any kind of solution where we will be able to build an ecosystem of all those big hospitals who will come into an umbrella, where they will all come together, they will have some agreed agreement and protocols where they agrees that yeah, we will be able to believe on this ecosystem, but the only condition is that the data should not be manipulated. We get the data which is fact, and that where the blockchain will play a big role in order to develop those terms and condition in terms of smart contract, in order to secure those transactions into the database that no one will be able to update that one, in order to provide those data to the other stakeholder in a real time.
Yeah.
In that way, blockchain will help a lot.
Okay. So you mentioned the smart contracts. So can you elaborate how smart contracts play a
Yeah.
role in achieving these?
Yeah, so it's basically smart contract is basically, if I talk about a layman language, it's a terms and condition between the two party.
Yes.
Whatever the written agreement which we are doing in a hard copy, why not to write in a soft copy with the help of coding, and we deploy it, and whenever that condition met, then only the transaction will happen into the blockchain. If the condition does not met, then that transaction will get eliminated and notification will get sent to the user that you have not met this condition and this transaction is not valid. It is basically a kind of in the terms of IT language, it's the kind of coding which is written in a programming language.
Yeah. Yeah.
It automates the process. Suppose I send a transaction from X to Y, okay, and I don't put any kind of condition, then it is okay. But there is a defined condition which has been agreed between X and Y, and says that if X send a Y a certain amount of money before 7 p.m., then it will be acceptable. If it is sent after 7 p.m., then it will not be acceptable by
Correct.
party B. So this is a kind of agreement which is made between party A and party B, and this agreement will be written in terms of programming language in a code. So whenever any transaction happens between party A and party B, first of all, whenever a transaction happened with party A, it will check that whether this transaction happened at 7 p.m., before 7 p.m., on p.m., or after 7 p.m. If it happens after 7 p.m., it will get rejected. If it happened on 7 p.m. and before 7 p.m., it will be accepted by party B. So this condition, when we written it as a part of a programming language code, this is called a smart contract in a real world, in a simple language. It basically automate the transaction without any intervention of the
Mm.
stakeholder.
Yes. Yes. That's a very good explanation. Thank you. And like, how about the compliances? Like how like we are
Yeah. So
blockchain.
compliances over here is very important. As we know, in the global market, there are a lot of compliances. One compliances is the patient privacy or
Mm.
the citizen's privacy. It means that whoever the citizens wants to share the data, it is the ownership of the citizens who own the data, and whoever he or she wants to data, he will share. Okay. So this is a good example, and this could be done with the help of blockchain based on the consent mechanism.
Mm.
Whoever the patient give the consent that particular person X will want to see the data for a duration of 2 hours, then only that person X will able to see the data for 2 hours only. After that, it will get revoked, and down the line the patient will able to see that patient B has seen the data for this number of duration. This is the patient privacy. The other part is that whatever the data which is not to be disclosed, that need to be masked into the ledger, and that will also be done in blockchain with the help of encryption. If someone wants does not wants to reveal the data, few of the data which the other party does not have that privilege to see, he or she can do that one with the help of masking, and that will get recorded into the blockchain. And these basically, this is HIPAA and GDPR kind of regulations which has came into picture, where whenever the patient wants to hide the data, he or she will able to hide the data. If he want to revoke the data, he can revoke the data. If he wants that the organization does not have the right to see the data, he can revoke that data. One of the best example is DigiLocker. Nowadays you can see that in the DigiLocker you can go and see that in the consent option, you can see that who all are viewing your data. You can revoke that one also from the DigiLocker. But but as it is a centralized, and the data is owned by someone, then there is some challenges on that. Why not to put the data into some multiple location and create a kind of ecosystem where to protect the data from misuse? So because of that, blockchain is required. Okay.
That's actually great. Like the owner has the control.
Yeah,
Like
the owner has the
whatever,
control.
like the patient has the control over here. And
Yeah.
even like even if you say if it is given for some research purpose.
Yes, yes.
So
That is
they
also on the consent based.
yes, on consent basis, but like probably they can get advice from the doctor and tell,
Yeah,
no,
yeah,
I don't
definitely.
want to reveal these things and all. But
Yeah.
for the research also, it will be much helpful because if you see the like, especially like the cancer research or something, we want the continuous data. See, like when the patient is going through, they need like a proper mental support, but at the same time if it has to be awarded for another person, they should be giving some data. Like it is
Yes,
our duty
correct.
to keep their like privacy protected, whoever is working on that.
Yeah,
At the same time, the patient is also like, if they are giving, uh, probably like family as well as the doctor's advice, everybody like they takes it, then like we can come up with, see, we can have some predictive tools. Nowadays that AI is booming.
yeah, definitely.
So
Yeah,
like
you
if
are
some
correct.
prediction is done at least 5 years before the onset of the disease, probably like they will not, they no don't need to undergo that pain.
Yeah,
Was
definitely.
like
It's all
cancer
about,
as
see what
such.
happened, that when we talk about in a holistic view, na, data is
Mm,
very
mm.
important,
Yes,
because data are being stored based on the experience, not based on the judgment.
yes,
It is
yes,
based on the experience, day-to-day experience. The data is getting stored into the database. And if you somehow store the data, secure the data, then that will bring a lots of value.
okay.
If someone, suppose I will give an example, suppose suppose there is one data. I will give an example of AI. What AI do? AI provide the structured information based on the data which is stored into the
Yes,
database.
yes. The training
If the
data.
data, yeah, if the data gets updated or data gets manipulated, then AI will only provide those data
Mm.
which has been manipulated. There is no way
Yes,
one could rectify that what has happened to the data.
yes, yes.
So
That is
it's a
true.
win-win situation, that if at the back end we are providing the user the proper data from the chat GPT and everything, we are providing the data, and currently everyone is following the data blindly, right? We are, if we want any kind of information, we go to the chat GPT, we ask the data, that data is being provided to us. We don't check the authenticity
Yes.
of the data. But if somehow we capture the authenticity of the data, then it is 100% proof to the user that whatever they are seeing with the help of chat GPT, that is an accurate data and that is not been manipulated.
Yes, yes. So
So
I
that
believe
what, yeah,
that
that how
GPT should
this,
use blockchain.
yeah, that is how this AI plus blockchain will come into together. This, yes. Hi, Garima.
Hi,
Uh,
Ashit.
I,
How are you?
I'm good. How about you?
I'm good. So I was going through your details. Amiji
Yeah,
has a
thank
great
you.
insight about all the government projects and how blockchain can transform it.
Yeah. Thanks for joining this meeting. Me and Anusya is having a discussion related to the healthcare, how the data is important, and she has few questions which she is asking to me, and I'm closely working to the government sector, so I'm doing my best to answer all her hard questions which she is asking me.
Garima, you can also join and ask few questions
Yeah, I will definitely ask.
in the healthcare sector.
Yes, definitely. I will ask.
So
So,
it
Amiji,
will be a kind of interview for me, right? Nevertheless, we all will work together to learn more and more on this about healthcare.
it's a
Okay.
brainstorming session basically. So, we will discuss and learn more
Yeah,
about the
definitely,
blockchain
definitely.
technology. It's a new technology.
Definitely. It is always coming together and learning from whatever each other experience, what we have in the ground level. Okay.
Definitely. We have to like just help, just like sharing and learning more from each other. Then only
Yeah.
we can.
Yeah, fine. That's why I'm saying, Anushya, also that if you can get take it to the next level where more speakers will able to join and they will able to collaborate, and there could be a kind of roundtable discussion, that will be great. Yeah,
Yeah, that will be definitely great. So we can have certain kind of sessions also.
yeah. So I think Anushya has a few more questions which we can discuss,
Yeah,
right?
please carry
Yeah,
on with the
yeah, yeah,
questions.
yeah, yeah. So like we have this decentralized identity solutions, right?
Yeah.
So how they can be used for patient data management?
So see, decentralized identity is very important thing nowadays, because it says about that how we are going to prove the identity while not revealing our overall identity
Yeah.
with the minimum information how we can reveal that what we are. Okay, so decentralized identity is a very important factor nowadays. Okay, and that could only be done when, suppose in the case of patient data, if anyone wants to use the data, then only the patient will send a request that that particular hospital or researcher or anyone wants to use the data, and we will provide a consent with yes and no without revealing much information. So DID being a very important part. So one of the example which I have recently seen is that whenever we go to somewhere and we have to prove that whether we are eligible for this particular facility or not, there is a condition that whether we are able to receive this facility or not, or subsidy or not. For that we have to show the entire information of us, right? Whether it is in terms of photocopy or whether in terms of information. Why not to only show the counterparty the information that whether I am eligible or not? That is only the counterparty will only able to know that I am eligible or not, yes or no. Apart from that, the counterparty does not have to know who am I, what is my identity, whether I am, what is my age, my address, other thing. So this is something which will play an important role in blockchain, which will help to secure the identity of the user, and without revealing much information how to access the facilities. Okay, and if somehow those parameters are being shared, then how to monitor those parameters, that I have shared to this particular entity this number of parameter on these days. This also need to be monitored carefully, because it's all about the ownership of the data being maintained by the patient. So in this way we can have the DID gets implemented in terms of sharing the patient data, in terms of sharing any kind of claim settlement wherever the identity is required. So DID is a very important part, and lot of companies are working on this aspect
Yeah.
to how we can remove this kind of barrier where to show all the details to the counterparty, proving that I'm the person whom they are looking for.
Yeah. Yeah. So
And
that's,
also it's a kind of wallet will play an
yeah.
important
Yeah.
role over
Yeah.
here, where within that wallet all the details of the patient will be there and they will able to share. DigiLocker is one of an example
Mm.
where we will be able to share the certificates to the receiver, and we can able to remove that one. But that is too on decentralized, and that is data is on in the, sorry, that too on the centralized, and the data is on the centralized in the server, and we can add additional layer of security in that. Okay, by with the help of decentralized.
Yeah. Yeah. That's great.
I think there is a message from.
No, 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 no.
Okay.
Because this meeting is already recorded,
Hmm.
it will be uploaded in the YouTube.
Okay, okay, fine.
So, I'm I will make this my last question. So, um, what is your take on the blockchain adoption in the global healthcare ecosystem?
Oh, that's a good question, because that is something that everyone is currently looking after, that how you see blockchain adoption into the ecosystem. Okay, so there are few aspects of this now. When I joined the public sector or any private sector, one has to understand the importance of data, because what happened, the data is always kept in a database, and
Mm.
that is a backend, and that is not shown to an end user who don't know technical. Everyone is aware of the end result. Everyone is happy that they are getting the end result, and they are getting in a structured manner and they are happy with that, but no one is bothered about how the data could be kept secured, right? So when I go to various government departments, when I go to the various private sector, I used to explain them that how the data is important. It is something that could not be visualized. It is something which can only become with an experience. फॉर एग्जाम्पल, इन एन हिंदी टर्म में अगर आपको बोलूं कि लोग गोदरेज का तिजोरी तभी खरीदेंगे जब उनके घर में चोरी होगा, अदरवाइज लोग 100 रुपये का ताला में भी खुश है. So this is
I
something
think
that
you have to translate it.
yeah, I will translate in English, that it is something that anyone will invest only on a higher budget side whenever they will see any kind of disaster with the thing which they are using currently, which is of cheap quality. So this is one thing. I will not say that currently whatever the system everyone is using is not good. Everyone is using centralized system, everyone is using their own database, that is definitely good. But why not to think in such a way to secure the data? Why we are waiting to give someone a chance of at least 10% to hack the data and manipulate it? If there is a chance of only 20 or 30% that someone is able to hack the data or someone is going to manipulate the data, keeping it into a but in a same location, why not to take an extra step to prevent those data to be get manipulated by someone, right? Keeping the data in one place and keeping the data in a multiple place is always a better option, because it reduces the chances of manipulation. So basically, I will not say that whether blockchain good, bad or not. It's about the experience, because blockchain is something works on the back end. Okay, and a few of the latest emerging technology which works at the front end. So there is no way that we can showcase that how effective blockchain is currently, because it works on the server side, it provides a data in a immutable manner, it stored the data in a decentralized manner, it provides the data in a transparent way that could be done in the current system also. But whether that system is secure, that everyone has to think. And when they think of the scenarios that what are the possible way one could manipulate the data, then only one will able to understand the importance of blockchain, why it is important. There are a lot of money invested in auditing. Okay, there are a lot of money invested in auditing. It's a million of rupees are being invested in auditing. Why auditing is required? Auditing is required to prove that the data which the auditor is saying it is accurate. That's why auditing is required, right?
Yes.
Auditing is required that whatever I am saying it is accurate, and for that I need a research that I am seeing the correct data, and for that I will involve my 1,010 people over there who will research on all the data and will see that the data is not manipulated. Then only I will trust that data is not manipulated. But if I provide a mechanism to the auditor that from the start only, whatever the data which is getting audited, nowhere one will able to edit the data or manipulate the data. Then when the auditor will come at the year end or the half yearly and sees the data, then does these people required to audit the data? No. It drastically reduce the number of resources also along with the duration to audit the data. So that is the return of investment. And that's why I appreciate that all the government of India, all the states within government of India, and also the central government, also the global government has figured out the importance of this technology, and they're trying lot of work on this technology to secure the data. And this same goes to the private sector also, that everyone is aware, every citizen is aware that whatever they are seeing, whether they are seeing to the actual data or not. So that's why when we see in that aspect, you will find that blockchain is very important in order to secure the data. In order to provide an additional layer of security to the data, in order to provide a transparency, in order to provide a real-time availability of the data. So when these all parameters comes into picture, blockchain will surely be adopted by all the stakeholder, whether it is public, private, or anywhere. When they see the importance of data, it's about the basically, in three sentence, it's about the importance of data, it's about how secure you want to put your data, and how easily you want your data to be available to all the stakeholders. These are the three parameters. If you want this, then blockchain is good. If you don't want to this, then you can go ahead with some other technology which are more better than this. Okay. Yeah,
Okay.
that's all from my end, and I think I'm able to answer all your questions.
Yeah. It is really wonderful to have you. And like you are such a resourceful person. Like we all enjoy listening and like we can
Thank
implement
you.
it also.
Thank you.
And
And I've
I
seen
don't
lots of messages in the message box.
so like uh I have done with the questions from my side, whatever I wanted to ask. Like I hope like it is useful
And
for everybody
I
also.
hope that I'm able to answer all your
Yes,
questions.
yes, very well, very
Uh,
well. And now it is open for everybody. Please feel free to ask questions.
Okay, so Amit sir, I have one question for you to ask and discuss about that our medical chain and how like how many data is there and how government is working towards the data privacy, security, and how we're maintaining the traceability of medicines in terms of QR code traceability is there. Then QR code can be also copied. So, is there any prevention that government is taking for that?
yeah, see, data privacy is one of the first important part of government. Okay, because in terms of whether it is for the citizen, whether it is for the department, then data privacy is a very important point for any government, because that's why the government is not jumping to the public blockchain. If I speak frankly, they are looking for a private blockchain, because within the private blockchain the data are more secured, and Hyperledger Fabric provide the same. And if we go to the trends, you will see that most of the government are working on Hyperledger umbrella only. They are working on Hyperledger Fabric. Why? Because they want to build a closed network where they don't want the data should go out of the network until or unless it is required. If it is kind of e-commerce portal, then that is different thing. But in terms of healthcare, in terms of other kind of department, they don't want the data could be go out of the ecosystem, and they want to maintain the privacy of the data in terms of within the department and in terms of citizens. Okay, now the other question of yours is the other question. Sorry, Ganima, can you repeat that question?
Uh, yes, other question was like that. For example, government is help with the traceability of supply chain traceability of medicine. So, like they're using QR code on the medicine, but QR code can be copied easily, and we can duplicate that. So, is government is trying to take any kind of measure for that, or what step they are taking it towards that to make it
See,
more secure?
yeah. So you are talking about the
QR
drug
code
traceability,
traceability.
right?
So
Drug
QR code
traceability.
can be copied. Basically, I can duplicate it easily and put in multiple medicines. So, what kind of prevention measurement government is trying to take towards that? Because usually on medicines we have QR code only.
Yeah. So there are a lot of things which need to be take care over here, because if we see that if scanning the QR code will make the difference, that is not one part. First of all, in the case of drug traceability, we have to understand that the entire life cycle of the drugs from manufacturer to the medical shop, right? And when the customer purchase that one. Okay. So that is definitely true that the QR code could be copied, okay, for the other medicine, but there are other factor which need to be also take care, and that will only be able to solve when there will be close discussion with the healthcare industry. Okay, whatever we assume in the current date, we are assuming outside the government sector, we are seeing that these are the process step and this is how the medicine is reached with the customer. But apart from that also, when we go to the ground level, we will see that apart from these parameter, there are a lot of parameter which are being stored into the database and that provide the authenticity of the drug, because one agency will not be rely on a QR code. Okay, there will be lot of things, there will be lot of composition of the medicine, there will be lot of serial number of the medicine based on which the government will decide whether that is a fake product or not. The only thing is that whether that fake product which is getting stored into the database will get manipulated or not, or how easily it could be available. So it's about the ground reality, and currently we are in a discussion with multiple healthcare industry to figure out that what all are the important parameter which could be stored in a blockchain, so that this duplicacy would be reduced in terms of the QR code or in terms of the serial number, or how we can do that one. There is also a case that within the supply chain process, when the manufacturer prepare that drug and that get transported to the this chemist, within that journey there should be a kind of temperature need to be maintained, and somehow that got compromised, then will be expiry of those medicine. Then how to capture those one? So it's a kind of discussion, it's a broader level of industry where discussion is required, and based on that we need to understand that what sort of parameters need to be secure in blockchain, so this kind of duplication of QR code will not happen, and there will be a alternative where we will be able to find the genuinity of the drugs which the patient is purchasing. So it's a kind of discussion, and we need to get in depth of that, and I don't have that much of idea currently that what sort of parameter we can store in that. Okay.
Okay, sir. It's a great answer from your side. So that like government is working towards a lot of things, and they have to decide parameter based on the medicines also. So
Yeah.
that is they can categorize that. So it is a great answer from your side. So I don't have any other question. Anusia, you can take it further.
Yeah, thank you so much.
Anyone else has the question, you can ask me. I
Yeah,
am
first of all, thank you very much, sir, for briefing and answering all the question that Ansuya and rest of
I
the
think you will be
panelists
the right
have.
person answering the medical one. I can see you are
Yes,
a
yes.
Yeah.
PhD SMI
So,
triple E.
so
To answer my
uh,
questions, I can connect with him.
yeah. So, if you allow me to share the screen, I can contribute to this discussion, and
Yes, yes,
also
yes.
would like to bring that perspective
Yeah,
into the
definitely. Why
consideration,
not?
right? So, uh, just please let me know if the screen is visible.
Yeah, yeah, your screen is
Yes,
visible.
it's
It is
visible.
in the login
Yeah, just a
screen
minute,
for of your mail, I suppose.
Yeah, we can see
okay.
the login or sign up mail from your side.
Whose this
This
screen
is,
is? I think this screen is for Mahendra, right?
Yeah.
yeah.
Yeah, yeah,
Yes.
yeah. Okay, okay.
So,
That's great.
there is one particular article that I would like to refer, that is
Mhm.
convergence toward blockchain-based patient health information sharing system, emerging
Mhm.
issues and challenges.
Wow.
So we listed down all the challenges that we are having from just
Mhm.
so we actually studied all the existing particular healthcare solution and all, and then we highlighted what are the problem and particular. So some of them I would like to bring into the discussion. That is what, let's say there is a some drug that we are sipping, right? And So it's just through label. Okay, so what actually this fraudster does, so they actually take out the original drug out of the strip, and then they'll print the label and then bring their duplicate drug and ship it, right? So
Okay.
here, actually, unless and until we are having two things. The first thing is what is a location tracking, GPS tracking should be also
Mm-hmm.
there, and also there should be smart lock, right?
Correct.
So for vaccine, another thing you can be able to do it, right? But for small tablets, another thing that is very hard to do that particular one. And also, uh, if let's say in component particular, when we are importing some of the components, medical components from different places and bringing it, right? So in between, if the sensing capability and location tracking and tampering capability is not there, then the particular items or component that is there, that can be also replaced. So overall, your drug particular one would not be that qualitative. Okay, so
Mm-hmm.
that is the component and shipping level, and another thing is what is with respect to the app based driven, where actually the private key is custodial, because the general public are not much aware, and it's a very easy to target somebody in device than targeting a blockchain system, which is in much secure manner, right? Residing in the militarized zone in the data center. So the trend we have seen is what is they actually go and target the end user and steal their private data and all those particular things. That's why there is custodial. And if we are storing their private key in a custodial, then the system maintainers, they can misuse that particular one, specifically the system admins. So there are these kinds of challenges are available that we have to still. But yeah, I mean there are technical solution, but the implementation is the challenge. So that's what I wanted to bring the perspective. Amit sir has already covered all those particular things. And if you are interested to have this particular one, I will share the link of
Yeah, please
uh,
share the link with us.
this
And
particular
also,
one.
it's great that you have given your viewpoint in this, and it's a great learning for everyone over here. And we can get in touch with you to get more idea and how the blockchain emerging technology could solve the purpose. So we can
Yeah.
have a discussion on this, and I think Anushya can keep a note of this, and we can have a more discussion, right?
Yeah, yeah. And I actually I welcome
And it's
you to give
great,
a
and
talk
it's a
on
great.
this.
What
Like
I can
we,
So
say that I will say that it's not a one-way communication, which
yes.
only
yeah,
me and Anushya is doing. It's a communication where everyone is a part of this particular discussion, and they are bringing up with their own problem solution, and it's a kind of collaborative effort. And the only blockchain theme is that all work together to
Yes.
make the data secure.
Yes.
yeah. So just Amit sir, just for your
Yeah.
perspective, actually I started in academics, then corporate, then I was working with recently government of Karnataka,
Oh, that's
in
great. Yeah.
center of smart governance, right? And we saw lots of problem, and we created some platform for state government of Karnataka. And then I
Hmm.
take a break to do some research work for defense sector, right? So it's good to see you, sir, and
Same here.
looking for contribution where we can contribute and collaborate, right?
See, I will tell you, Hyperledger Fabric is a community, and this particular Hyperledger India chapter under Anushya, she is maintaining it very well, and she is
A
collaborating that
small
all.
correction. Hyperledger India chapter, co-chairs are Kamlesh and Vikram. I am the student chapter lead in that.
But
This
but then
healthcare
also
special
the
interest
effort.
group,
You
I
you
am
are
the
also
Hmm.
doing
India
that.
leading.
Yeah, yeah, but then
How we
also the
could join
effort
there?
which I can see, then also the effort which I can see, and the enthusiasm which I can see from your end, is recommendable, and that is great to see that you are bringing all
Thank you.
Garima,
Thank you.
me, and also Mahendra, everyone in this common platform where everyone is getting interacted, get to know each other. It's a great thing, and I think we appreciate all your effort doing this for us. Okay.
Thank you. And
Yeah, you're doing a
I,
great job actually. And I can say Anusuya, like chapter is lead by Vikram, Anusuya, and like Vikram and that Kamlesh and Ankita. But like they are the co-chair, but you are also doing a lot in Hyperlab space. You are handling the special interest group. You are handling student chapter. So
No, that's a
you
great
are
thing,
getting
na,
roles.
and
because
you are also part of India chapter,
Yes,
Garima. Like,
I am also part of in the government lead. I'm in India chapter
yeah, yeah.
government lead.
yeah,
So
yeah.
I'm
I'm also a part of that, but I didn't get that much of time to be a part. But somewhere when Anushya want me to be a part of such kind of discussion, I'm
We will
always
be there.
ready. Yeah, yeah,
yes,
I'm ready to Garima also, Anushya also, and everyone who wants me to be a part of that. And that is the beauty of getting all into a common platform, learning from each other, and try
yes,
to
yes.
figure out, we come out with a solution which is sellable into the market.
Yes, yes.
Yes,
Correct.
yes, definitely. So even I will I will go through the profile of Mr. Mahindra, so we can connect separately. Also, I have seen your profile on Google Scholar, so you have done tons
I
of
think
good
everyone could
work.
share their profile in this chat so that we can add
I will
each
share
other.
the link. It is open in Google. Just search his name, you will get that. Or I will share the link. So
Mahindra.
um, I'll let me share the link. I have the link.
Yeah, yeah, please share with me. Okay,
I will
so it
share on
will
the
be
WhatsApp.
great connecting with you all. Anyone
Yeah,
has any
usually
other
people are doing
question?
that.
So actually, like what Garima was asking regarding the QR code and what Amit said and what Mahendra has given, he is almost close to the solution. See, we have something called IoT,
Oh, that's
Internet
Yeah,
of
great.
we
Things. That is the solution for all these things. Like
so I
actually,
ask him. I want
I
you
BiniWorld
to
is
think
explain.
like working
in that
on
way,
that.
Anusha, you can
So
provide
we
the
can,
demo to Garima also and us also, right? You can
yeah.
provide a demo to every one of us so that we will be aware that how that QR code will work.
Yes,
Yeah,
we.
that is why I asked Karusi. I want you to answer that because you have been working towards
No,
that.
no,
Na?
it
That
is
is why
not
I
yet
asked.
fully developed, but that is like theoretically I can tell that that is the solution. We can work on that. Like we have started working on that. Probably like very soon, like we will be able to get the answer. So I will be able to present
Yeah,
it
yeah,
to
that's
also.
great.
Hmm.
That's great.
So
Yeah,
and
definitely.
so
We want
actually
See,
today we
you also to
have
present the solution to us in this group. Maybe in upcoming meetings you have to present your solutions. We want to see what you have built. So that time I will host and you have to present.
yeah. Yes. So actually today we have overshoot the meeting time by half an hour.
It's okay.
8:30 to 9:30 IST it is supposed to be.
I
We
think this is
had
only because the
Thomas.
kind of discussion what we are having. So it's great that everyone
Yes,
is talking
yes,
and discussing on
yes.
this panel. Thank you.
This is what is needed
Thank you.
actually
Yes.
for
Yeah, yeah.
like
Thank you. It was a great discussion actually.
yeah, yeah. So
Yeah.
we had Elizabeth Green, like she joined and she left some time back. Even Thomas was there till now. I probably he would have jumped into another meeting. So like it's a good like uh, people number of people today. So thank you everyone, and like
Thank you. Thank
you
you.
can get
Thank you
connected
all.
and keep joining the meetings. So, healthcare special interest group meetings is a global meetings, like it is happening on every third Wednesday of the month. Every
Okay.
month, third Wednesday, 8:30 p.m. IST, that is 3 p.m. GMT and 11 a.m.
Mhm.
ET. And like for US timings, their daytime. So they have a confusion. I don't want to comment on because I myself will get confused with their timings.
Ah,
Probably they have to like adjust. So I don't know like when it will
I
be.
think it's a suitable time for them also, right?
But it is morning time. I have
It's
made it
morning
sure
for
it will
them.
be either 7 a.m. or 8 a.m. So they have to choose
It
which time it is and they
Yeah,
are
yeah, it is
replying.
downtime for us. It is downtime for us, but not
Yes,
for
yes.
them.
So we have kept the
Yeah, yeah.
meeting in such a way. around the globe people can join.
Yes, yes,
So
definitely,
like
and I appreciate
it is
those.
little odd time for Indians, but us, but like for other people, either it may be early morning, midday, afternoon, like that. So like normally people used to join on and off, not very frequently, but I hope like you people continue joining and bring your friends also. We can have great discussions. And Dr. Mahendra, I want you to present your paper on one of the
Uh,
meetings, 1 month.
Yes,
yeah,
yes,
I
yeah,
we want.
have
sure, sure.
shared the
Um,
link with you. You can choose the dates, which month you want to, and like you are most welcome.
yeah, yeah, sure, sure. From now onward, I'm going to be a regular attendee to
Yes,
this
please.
specific meeting because at India Quantum Lab, one of the initiative that we are taking for specifically healthcare related to farmers, right? And I'm going to collaborate with all of you and to learn from you that how we can collaboratively uh, um, make certain product or certain open source collaborative product where we can solve those problem specifically targeting to the farmers, right? So let's see how it goes about, and
Yes.
I'm very sure I'm at the right time. I joined the
Yeah,
right
we
like
are
meeting
glad
and
that
right.
you have joined, and I said that information is something that always gain when it is getting shared by in within the
Yes,
ecosystem, right? And
yes,
we
yes.
get to know a lot of things from you also, Mahendra, because what the thing I feel good is that today it is not between me and Anushya, it's between the entire team who involved and discussed with us. So that's a great thing, and this kind of discussion is required. Correct?
Yes,
Yes,
yes.
yes, yes. I agree, sir.
Yeah, and I have shared the meeting agenda with you, and like would have those who have the LFID, you will be getting the mail also. Others,
Yes,
please create your LFIDs. So like
sure, sure, sure,
the
sure.
and subscribe to the group. So you will be getting the meeting invitation, everything automated. So
Yeah,
thank you once
sure.
again.
Thank you,
Good
everyone.
day
Thank you,
and good
Thanks,
night.
everybody. Have
Anushya.
a very
Good
Yes.
night,
Thank you very
everyone, and
much.
good night, everyone.
thanks. And meet you in LinkedIn anytime you can ping me. Okay.
Yeah, yeah,
Yes.
sure, sure,
Thank
sure.
you, everyone. Thank you.
Thank
Bye.
you, everyone.